here we are at our last session for HTID6. And I'm delighted to say it's a look into the future. We have our panel assembled, and feel free to interact with them. I will be on standby with the microphone at all times. So if you have any questions or want to throw a question to the panel that they might not be expecting, because it's about the future, who knows what's going to happen, feel free and I will be on that microphone. So I would like to introduce you to Ivan Cohen-Tanugi, who will be your moderator, and I will hand over to Ivan to introduce his panel, or they can introduce themselves depending on your rules. Enjoy.
Thank you. I'm just going to present this roundtable first, and then we'll have the introduction of our panel, with 4 great experts. We've been hearing a lot during the past 2 days about very innovative and very attractive projects. And now we're going to move away from the cure to talk about more prevention, about integrative medicine, and about the future, and potentially silver economy and healthy aging. So a lot of topics for 40 minutes, a bit ambitious, but interesting and attractive subject. So what we would like to address during these 40 minutes is really the growing need for a global preventive and integrative therapeutic approach. And we will discuss some great project initiatives that especially La Poste and Novo Nordisk are putting in place. And what would be interesting is to see how we can scale up this project, because to have an impact, we need really to have a very large impact at the local level, and really make this link between the cure, the prevention, and also at the end the healthy aging. So before really moving to all these topics, I'm going to let you introduce yourself, and then we will move into probably the prevention topic first. So, Etienne.
Yes, good afternoon. My name is Etienne. I'm heading up the Novo Nordisk affiliate here in France. I'm heading up also the net zero roadmap for the whole pharma industry in France, with a national council of industry, and also work for a cluster, basically to reinforce environmental performance of our companies in the whole chain, in the whole value chain. Sorry.
Alain.
Thank you. So Alain Toledano, I am oncologist. So first of all, I am director of a center at Cole-Hartmann that treats 4,000 new patients per year. And also I am medical oncologist, so treat patients with all the molecules and innovations. And I founded an association, Institut Raphael, that offer for each patient free of charge all the pathway and coordination of this pathway and evaluation, dedicated to nutrition, emotion, physical activity, well-being. And also I chair academic share on integrative health.
Thank you, Alain.
Hello. Hello. I'm Florence Dupré. So I've spent the last 30 years in the pharma industry, the medtech, and now I'm in the service, human and digital, and I will speak later on La Poste. International experience, French experience, business experience, and also competency development. So very happy to be with you today.
Alexandre.
Hello, my name is Alexandre, and I'm a French advisor and consultant for the silver economy business in France. I help society through this ecosystem to innovate and identify the right client in order to distribute their product and services.
Thank you. As you can see, we have really a great panel with very different experiences. And I'm sure that already some of you are wondering what La Poste is doing here. So we'll have some discussion and very interesting interaction on this. So maybe before starting, I'd like to maybe have, at least for some of you, your view of prevention, because it covers really a lot of topics. We always talk about prevention, but I'd like to have maybe first Etienne on the industry perspective.
how would you define prevention, and what's your view and maybe a view of the future of prevention on the industry side?
So the first thing is, if I sit in Novo Nordisk case, I'm looking at the challenge that we have ahead of us, which is, currently close to 1 billion people living with obesity, close to 700 million people living with diabetes. So the question is, all these chronic diseases are just rising, and the question is how to address, the prevention in this context, because not only that we are innovating and providing solutions, we're also working on something which might look like intuitive, which is basically to deliver and to try to basically model prevention activities and prevention programs. So this is what we are doing throughout the foundation. So one point around prevention is how can we finance prevention, which is the name of the game most of the time, and belonging to a foundation. Actually, it's a great opportunity basically to finance prevention. And as I say, the question for a company like us is how do we secure that there is a sustainable model between generating revenue out of innovation when people are sick, but also reinvesting through the foundation in a prevention program. And how do we model the prevention program in order basically to have impact? 2/3 of the patients are living in cities, and chronic patients are in cities. So how do we address it through the cities? And I can share an example later on. But we all think of secondary prevention when we sit in pharma groups. What really matters to us is prevention, primary prevention. How can we avoid that the patient or the people will become a patient?
Okay, thank you, clear. Maybe we could have also the view of a physician, Alain, on the prevention side, and maybe you can also elaborate on the role of physician versus others.
Thank you. Okay, we know that 40% of cancers are avoidable and 80% of cardiovascular disease. But we affect only 3% of our budget to the prevention. So if we know how to avoid tobacco, alcohol, overweight, sedentarity, it will be very important to change our prism of manière to work. So the subject today is that medicine is not only the technologies, the drugs. Medicine is all the means, the knowledge that permit us to prevent and to treat the disease and disabilities. So with word we work, with word we kill, and we care also. We have a medicine that treats disease and not only patient. So the subject for us is a vision of the health from the prevention to the rehabilitations. Physicians are not only the actors of treating disease, so it is important to make a special place for prevention to transform our culture of health.
But how can we put that in place really when we see the way the healthcare is organized and structured and the resources? Because it makes sense, but it seems that there is a kind of a gap with the reality today, no?
We have maybe several manières to do, but we know that what we have to avoid. We have today 1 billion consultations per year in France, each year. And half of them are to treat symptoms of chronic disease, not to do diagnosis. And the doctors today cut the speech to patients after 23 seconds. And we prescribe, in 93% of cases, medications. So our neighbors is 40% as they live with the same life expectancy. And we throw 50% of our boxes of drugs. So 7 billion euros per year we throw in France. So what we have to do is to consider the quality, the time that we give to the patient, and we have also to work on the environmental situation of patient and comportamental also. So we need time. The time is quality. So if we have to modelize the system, we'll have to modelize the time we will be in front of the patient, the time we will have to listen to the patient, and how to listen to the patient also. Because we didn't know several years before that pollution was a risk factor of breast cancer, for example. Pollution makes 9 million deaths per year in the world, and we didn't know that there was a link between pollution and breast cancer. When a patient stops smoking and she's at home and she, I don't know, elle allume une encens, 1 hour with an encens is 12 cigarettes. So we have to create new knowledge on the environmental health to integrate the different aspects of the health. The health is not only the absence of disease, it's composed by the physical health, emotional health, sexual health, environmental health, cultural health. So we have to enlarge our manner to take into account all the parameters and the patients in the globality.
Thank you, Alain. So it gives us really the right word to really ask Alexandre his view on this integrative, on the perspective of integrative medicine.
Yes, thank you. My purpose when I work with silver economy enterprises is to try to understand how the mindset of old people and their family will evolve. And from now, we realize since several years that people don't want to die in a retirement home, what we call EHPAD in France, but they didn't had a preventive attitude before. So for today, people have to go in EHPAD because they have a lot of chronic disease which are very difficult to treat at home. And that's why we do want to educate people to develop a preventive attitude. And it's difficult in France because when you talk about prevention, we have a very negative vision of prevention because we say French don't want to make prevention because we have social security and a very good health system, and so it's not necessary to be preventive. You can be healed and you have a very good treatment, etc. But when people do say such things, they didn't experiment illness, and so it's difficult to have the same comportement when you are ill. When you have cancer or Alzheimer, it's difficult to say yes. I prefer to be ill because I have a very good medicine and social security, etc. But it's too late. And what we have to develop is not understanding what illness is. It's more developing behaviors and habits in different parts of our life in order to avoid illness. As Alain was saying about cancer, a lot of a significant part of chronic disease can be avoided by having the right attitude and habits. And I think people don't understand because they can project in illness and dependency. And so we have to develop small habits in different situations, as what do you eat, how do you make activity, how do you connect with other people in order to avoid the chronic disease you develop if you don't have this kind of attitude.
But today, we could say that we want to prevent and change behavior of people like 40-year-old, etc., to have an impact 20 years later. But it might be very difficult at 40 already because you have all your habits. So this prevention should even be like at school. But on the other hand, it's very challenging. And then you're saying, prevention for 40, 50 years down the road, and the return on investment for government is maybe not that interesting, no? No?
Well, we have an American study on the veterans,
Yeah.
260,000 patients that compared with 8 factors de risque, sleep disorders, smoking, opioids, social life, sport. And we know that at the age of 40 years, if you have no factor de risque, you will have 24 years more life expectancies than the others. So at 40 years, you have also to promote prevention, not only in the childhood.
Okay.
To complete, we see that Apple, for example, is developing a very important program on the Apple Watch in order to detect more and more disease and to develop habits for people to control and to react to this disease. And so when you wear an Apple Watch or any wearable like Apple Watch, I think people who buy an Apple Watch and who discover the health program behind Apple could be good clients for a preventive operation. And so you just, I think Apple, it's Apple's objective to develop such a preventive, but they didn't push the whole program in Europe because it's difficult for them because of the European regulations. But it could be their next move. And so as an enterprise in France, we have to realize that this next move from Apple is coming, and how do we want to react or to be on the course when it will quand ça arrivera.
Thank you. So we had your views on the prevention side from the industry, the physician, and integrative medicine. So, La Poste, Florence, tell us more of your view and what is La Poste doing in this world? Because it's not obvious. We talked about it, and I read a bit, but I'm sure for most of us here, it's a bit surprising. So can you tell us more and explain more the view and the projects
Absolutely.
and initiatives?
So basically everybody knows La Poste, at least in France, and we have the La Poste Museum. It's a 600 years company. But most of people don't know that since 10 years, La Poste is acquiring health companies. So some are human, so it's home care companies. Others are digital, so it's platforms development. It's artificial intelligence. You have companies like Mindcare that are basically the tool of the hospital, you know, to get reimbursed by the state. So most of the system, we can produce it for the hospital. So we are in the hospital. And we also have some consulting companies. So all those companies are answering the positioning of La Poste. You know, La Poste, 10 years ago, it was 85% of mail, paper mail, okay? And today it's only 15%. So it's a complete change in the scope of La Poste. And when we think about the ambition of La Poste 10 years ago, it was to become the first European platform of services, human territorial services, and digital third-party trusted party. So it's human and digital, because we need both. And when we speak about health, when we speak about human, it's really to transform home into a point of care. But to do that, you need to integrate home into the healthcare system, which is not the case. And you need to be very strong on data, because if you can't share the data from home, you can't become a point of care at home. So human is to transform a point of care at home, and digital is to get the data, inform decisions, and inform economics. Because in the last roundtable, the economic around prevention or mental health is very important. So you need to inform decision. So basically, since 1 year, Dominique Pont joined La Poste, and I have the pleasure and honor to work with him. And he has positioned everything that we do in La Poste, so the 30 companies that we have acquired since the last 10 years, around health pathway. And the difference between health pathways and care pathway is that in health pathway, you have prevention and you have home, not only hospital and retail specialist. So that's the objective, and we have 3 elements that are very important for us. The first one is that we want to orchestrate better the health pathway, because you know that pharma, medtech, we have clinical results, but what does it take in real life? You know, some people say that the difference between clinical results and real life is something like 40%, 50%, 60%. So we need to maximize the outcome of the pharma companies, the medtech companies. They have spent billions to develop product. And we think that with the platform that we have, we can maximize the health results. But if you maximize the health results, you need to capture it. You need to analyze the data, the real world evidence that you have maximized. And because you do that, you are able to go back to the authorities to show the results. Because we will never be able to fund prevention if we can't show efficiency into the system. So that's really our aim. Orchestrate the pathway, analyze the data, and go to the government to valorize it in order that everybody benefit from it, from the patient, the pharma, the medtech, and the government.
Very, very interesting and innovative. You're talking about orchestrating the pathway. Can you be more precise to understand what it means for a patient, for someone at home?
So when you are ill, or when you have elderly parents, or when you have handicapped, disabled children, you realize all of a sudden that nobody is taking care of you. You are the one to take care, to call the doctor, to find the hospital, and when you are in healthcare, it's more easy. You know in which hospital going, you know which doctor seeing, you know which drug taking, but we not all work in healthcare. So most of the people, in French we say it's BB. You know, it's who is taking care of your pathway. It's BB. It's yourself. So what we aim is to have this platform that is an orchestrator, which means that we can host solutions from other companies. So if a pharma company has a very good app, we can host it in our platform, and we can do event management instead of the patient. Because today, 10 years ago, we were saying we need to empower the patient, but at the end, you overwhelmed the patient. And digital is not helping, because digital is fragmenting. You need to go to the solution of all the actors of your pathway. And what we are offering with CareSide is a platform where pathology by pathology, you can find everything that you need to have a fluid pathway, and that somebody take care of you instead of taking care yourself of your pathology.
Very interesting, thank you. Etienne, you have also with Novo, I think, a very innovative initiative, Cities for Health. Can you explain a bit more and really link to the La Poste initiative and Alain?
To any initiative around the table? No. I think there is no magic bullet as we speak. When it comes to addressing prevention, and the way we're approaching it is actually to try to make prototypes, and test hypotheses. This is what I like also from Alain and his initiative, and also what La Poste is doing is trying to prototype a solution. So for us, it's targeting cities and thinking, okay, so now creating a network of 47 cities across the world, called Cities for Better Health, where the whole purpose is to detect where the problem is or is acute. So, for example, if I take Strasbourg as the one in France that we have established, but now back 3.5 years ago, in Strasbourg, basically, we have looked at Strasbourg and the municipalities around, you know, and so it's 30 towns that we are talking about. Around these 30 towns, basically, we have identified where problem of, you know, acceleration of chronic disease like obesity, diabetes, but, you know, and cardiometabolic disease are expanding, and you know, create a network. So with 14 other partners, basically to try to address it in the best possible way and measure. So here the interesting thing is, because we always talk about, you know, money and how do we organize and so on. The great thing is, you know, sometimes if you align private, public associations, you know, there are lots of people that are working for the same objective, but maybe a little bit discoordinated. So here in this case, it's, you know, to say, okay, we have 6 areas where we have targeted interventions with 14 actors for either early detection with Centre Européen d'Études du Diabète, with the university hospital to make programs on the better nutrition, food and so on, precarity with food banks, actually with a program that is, you know, to bring better health also in the plate every day, even if you are short on resources. Address the problem also, you know, in the schools. So in the schools, it's not only you know, delivering programs; it's also securing that you have, you know, greenhouses. So we have built. It took us 2 years basically to build 2 greenhouses in 2 schools, just because, you know, bureaucracy in France is sometimes a bit longer than we expect. But it took us 2 years basically to end up with, you know, now greenhouses with cabbage and you know, and fruits that are, you know, made, you know, inside the school, so the kids can eat more healthy and they can also bring this back home. And it's quite interesting because when you start to address it, you see all the problems. So, for example, with sport association companies that we are working with, they also have detected all the bad habits that you have, you know, when you eat your lunch, especially when your parents cannot afford to go to the canteen. So suddenly you have a, you know, big bag of chips, potato chips, you know, sodas, you know, 1.5 liter, you know, triangle sandwiches and so on, the worst ever. So as you say earlier, you know, we can start, you know, at a younger age, but that's a good start at least. But what is important is all these programs are also trying to bring back home also things for parents basically to change their habits, you know, use more cabbage and so on. So it's an intervention where now we have, you know, almost 20,000 people that have been through, you know, these programs, you know, including children, adults, people, you know, suffering from precarity and so on. So we have clear intervention, and with Observatoire Régional de la Santé, so the regional registry for healthcare, basically we are gathering, you know, every 3 years the impact of what we are doing here. The interesting thing is 47, you know, cities. You know, it's also a clear network, basically to work together to understand what has been done in Rome, what has been done in Seattle, and so on, and try to replicate. But the fundamental start of the initiative is something that is very much in the Danish DNA, I would say, which is this private-public, you know, associative network, where everyone has its own seat, and there is no better than other, you know, to provide, you know, better health, and as well as the fundamental, you know, reflection that prevention is something, it should be a competency that is living in the cities. And this is what we see in Denmark. So every community, every city has a prevention expert and is able to deliver prevention because they know what's happening. They know the elderly patients, they know the, you know, the young patients and young people and so on, and they can do prevention much better than having people that are trying to make, you know, national ads on television.
Thank you. Yes, I'd love to have,
Yes,
I mean, Alexandre and Alain reacting to these two initiatives.
My first reaction is, wow, it's gross, it's cool. But my second reaction is, why didn't I heard before? And that's a problem, I think, because in my ecosystem, we didn't heard about this initiative, and it's a very important initiative for my ecosystem. So and I think it's the same way for citizens. And that's why this kind of project as La Poste or as Novo is important, because what we understand about prevention is if people don't want to make prevention, how do we build a more preventive society? How do we develop what we call universal design in prevention in order to help people be preventive, even if they don't want, even if they don't know they are. You were talking about food habits. In France, in Europe, we have the chance to have access to fresh products and to be able to cook, which is not the same. The same in the US, where it's very, sometimes in some neighborhoods, it's very difficult to find fresh products. And so we have to capitalize on this in order to educate people on these habits, but also in order to give them access to this, because we know it's good for health to have this kind of access. And the system we could develop with prevention could be more efficient than trying to develop individual habits, which is very, very, very long and difficult. And as in climate, I think we don't have enough time to wait for people to change individually their habits, and we should try to build systems and community which are more effective for their members.
Thank you. Alain?
It's a great project. I am very happy to hear that. Our pharmaceutical industry is an important actor of the health, not only of industrialization of the drugs. The main subject in the next year will be the transformation of the culture. And to know that you do such investment in terms of health, even if you do not have marketing interest or direct marketing interest, is very important for all the system. Today we know that there is a rapport McKinsey that says that if you decrease by 30% the avoidable mortality, so before 70 years, you do an economy of 10% of GDP. So it's $100 billion or euros each year, and we will have money to invest in terms of innovation. So there is a medico-economic interest also to inject money and resources in prevention. And we cannot continue to treat disease and to have large cohorts of people with disease chronic and to invest only in the hospitals. So the health is not only the hospital, and we have to promote this type of programs and the changement of culture.
Just maybe a number to build on, Alain. If we look at, if we talk about, for example, obesity, which is one of the major topics these days. We are talking about 11 billion euro impact on France. So it's really important, and this is half of the budget that we are dedicating to drugs in France. So you can imagine that if we can prevent, then we have we are on a much better track. The other thing is, if we look also at numbers, the projection for 2030 is already 2.3% of national the PIB. I can't remember, GDP, sorry, thank you, will be affected by obesity. So the question is, there is no debate when we talk about, do we have money? The question is, can we afford to have this in 2030, which is almost tomorrow?
But it's a total shift in the way we're thinking, and our government is thinking, or the insurances are thinking it.
But again, we talk about public, private, and associations. There are lots of people that are already trying to deliver something. So I like the idea of coordination and so on, and establishing a plan that is with what I like in your approach in Institute of Health is also that you measure everything. So you try to measure the quantity of health that is delivered, the expectations of additional years of good good health and so on. So I think it's important also to have indicators and to live well with the idea of having indicators.
Just for example, we know that in breast cancer, we prescribe in 80% hormonotherapy. But we know that 40% of our patients do not take their hormonotherapy. For some of them, they are afraid to gain weight, or they are afraid with image corporal, body image. So we have an atelier of dance therapy, and we have measured that we decrease by 80% the arthralgia, the pain arthralgia, and we increase the compliance to the medication and the hormonotherapy. We decrease the sleep disorders, and we ameliorate the self-confidence and the body image. But of course, no one will reimburse dance therapy. But we have to think differently, not only on medication and medical consultation.
Yeah, maybe to add on and to reflect on the discussion on the funding, we desperately need to find new way to fund prevention. And when you look at the other countries in Europe or in the US, they don't have this kind of issue. Prevention is much more well taken into charge because if you think about integrated care, if you think about value-based healthcare, all those models are very difficult to implement in France. When I was the head of Medtronic, it was one of the only countries in Europe that was not valuing efficiency. So your product provide efficiency, so get money into the system, and you as an industrial, you don't get back this value that you put on the system. And I agree with you, Etienne, we need to measure. And the purpose is one, to measure, and then to valorize. And the biggest issue we have in France is a question of organization. You can't be efficient if each of the departments that are in charge of a part of health is looking at itself. Efficiency can only be taken in a holistic way. So you need to measure around all the health pathway. What is the efficiency? What is the cost? And what is the benefit? But today it's very fragmented. So that's something that we need to solve. And the big issue, and you speak about the silver economy, I rather think today that we will have a silver tsunami. Because aging, and the number of people that are getting more age, and that they will need care. And there is a very, very important program, integrated care for older people, which is called ICOP. And La Poste, since 10 years, is developing an ICOP program, and we want to really show, and it's proven, that if you detect on an old person something that is getting wrong, if you correct it, the person is staying in health. If you don't detect it, the fragility, the person is getting worse and worse and worse. So there is a moment where it's too late. So you have the delta under the curve, and it's benefit for the patient and for the system. And the more the time is coming, the more the tech is expensive, because we are progressing, science is progressing. So we need to find a way to show the value that is undisputable. And that's the reason why we are really working on that, because of our status, because we are a private company, but that is publicly owned. So we are of general interest, and we want to sit with the actors on redefining new contract between the CEPS, the HAS, and the industry. And that's really something we are very working hard on. And maybe to finish on this point, I'm sure that you are aware about the appel à projet of the Innovation Agency that has now been published. And if you are not aware, there is a webinar organized Friday by the Innovation, by Liz Alter team. So it's the purpose of this appel à projet is basically to show that you found, if you do prevention, it's not a cost, it's an investment.
Maybe just as a conclusion, 1 second, it seems that we know, you have demonstrated that we know what has to happen. now, and we see great project now. The problem, or what has to happen, is really a shift in the way of thinking, organization, funding, maybe transferring the prevention from physicians also to the local authorities, etc. So the shift, it seems that we know what to do, but to scale up and to have an impact, there is a huge shift to happen. So big challenge.
Can we take a question?
Yes,
we have 1 minute,
1 minute
left
I'm
to
sure
take
there
a
are.
question. Any questions? It's easy to forget the 10 minutes for questions, isn't it?
Thank you. I live abroad for many years, and what strikes me is the lack of priority of primary prevention in France. I live in Japan, as some people knows, and primary prevention is a top priority of public policies. And it goes everywhere, from government initiative, city initiative, prefectural initiative, everywhere. And so from a public perspective, we are reminded every time you need to go, you are 60, you know, to go to the dentist for a check, you need to have that, and that. But more than that, the private sector has a role to play, especially the company, you know, and company are incentivize their employees, you know, to do medical check every year. The last thing is, and this is a key things, what is the balance between empowering people and being directive?
Good question at the end there.
You have -3 seconds to answer. Okay, good.
There was a question in at the end there. What's the balance?
The conclusion, well, first, thank you very much. Very instructive, and thank you for your expertise and all your projects. I think that, Christian, next year, we're going to ask for half a day for that kind of session, because... Yes. Yeah. So thank you very much. Thanks.
Thank you all.